John, for hosting us here, and thanks to your staff who've really done a great job of getting things ready for us today. I'd also like to thank Senator Khan and Representative Oaks for being here to lend their support to the program. It's great to have leaders such as each of those to be here in support of the program. And thanks to all of you in the Great Lakes region for being here to this regional kickoff event and public awareness campaign for HIP Michigan. A recent analysis by the federal government shows that there's up to 129 million Americans under age 65 that have a pre-existing condition. What is a pre-existing condition? It's a condition such as heart disease, cancer, asthma, diabetes, high blood pressure that affects people's daily lives. And in many of these types of examples of pre-existing condition, there are ongoing conditions that require constant attention and constant care for millions of Americans. Americans between the age of 55 and 64 are at particular risk. Almost 90% of people in that age group have a pre-existing condition. And as many as 30% of people under the age of 65 are going to likely acquire a pre-existing condition in the next 5 years. So pretty staggering statistics in terms of the types of people that are affected by a pre-existing health condition. And up to 1 in 5 Americans under the age of 65, almost 25 million people are uninsured. This is where the HIP Michigan program, as part of the PPAC legislation, comes into play. It's a program for people that have pre-existing conditions and who have not had health insurance over the last 6 months comes into play. These people in particular need to know about the HIP Michigan program. HIP Michigan is an accessible program. It's a first-come, first-served program for people that, as I mentioned, have not had health insurance in the last 6 months, who also have a pre-existing health condition, that have been unable to obtain some type of commercially available health insurance program. HIP Michigan is affordable. It's for patients who can't get health insurance today to cover the pre-existing health condition that they may have. The premium payments are based on what an average healthy American may pay for health insurance. The premium costs do vary by age. It's available to any Michigan resident that's also a U.S. citizen, regardless of age. So there may be other programs available, but HIP Michigan's available to all Michigan citizens, regardless of age. The key difference, though, in HIP Michigan as to other type of individual products is it is available and covers the pre-existing condition that they may have. It can provide critical access, in some cases life-saving access, to health insurance, and provide real financial and emotional relief to those who have struggled to find affordable coverage. The premiums range from about $181 for a subscriber under the age of 24 to $686 for an individual over 60 and above. The coverage does include a comprehensive set of health-related services. Co-pays for physician offices range from $20 for a primary care visit to $30 for a specialist visit, $100 for an emergency care visit. There is a deductible, a $1,000 deductible, an annual out-of-pocket maximum of $2,500. The program does include a comprehensive set of pharmacy benefits. The co-pays for that service range from $10 for generics to $30 for many brand name medications and $50 for other types of brand name medications. So this is a comprehensive set of services that would be very similar to what many groups would offer to their employers. Most importantly, it does provide peace of mind. It offers individuals with an opportunity to obtain affordable health care and free them from the fear that comes with being uninsured. In particular, it helps people with cancer and other serious conditions. I'd like to address for just a second the affordability again. For a person, let's say, that's in their 60s paying a $600+ a month in premium, while that may seem expensive, in general, they're paying about $1 in $4 for the program. The federal government subsidizing the other $3 of the program. So for example, we expect someone eligible under the program who's paying $600 a month in premium would potentially get a benefit in excess of $25,000 a year. So you look at the financial costs they're avoiding, it's pretty significant. Because of HIP Michigan, people are already booking surgeries and doctor's visits today, getting chemotherapy that may have been long delayed because they didn't have health insurance available. And we've heard real stories from people who are thrilled to be able to get access to this program. The program is comprehensive. It includes medical office visits, prescription drug benefits, emergency care, hospitalization, surgeries, wellness service, and behavioral health services. Most medical providers and pharmacies in Michigan participate in the program. The network is comprehensive. If you go to the hipmichigan.com website, hipmichigan.com website, you can look at the comprehensive list of providers that are available. If people are interested in applying for the program, they could learn more at hipmichigan.com, or they could call our information hotline at 877-459-3113. We'll be processing applications as quickly as possible. There's a 30-day turnaround, but right now we're running much faster than that. I encourage people to call to get information or to go onto the website. What we recommend is, if you're not sure if you qualify, go ahead and call or go ahead and apply, and we'll do our best to get back with you as quickly as possible. We are turning applications around rather quickly at this point. We need all the documentation that's required as part of the application, plus the first month payment, and we can get people signed up within a 30-day time frame. Really, the final point that I have is, for the first time in Michigan, people with serious health pre-existing conditions will be able to get high-quality care without a prolonged waiting period. So it is important that we get the word out, talk to your friends and neighbors. If you know someone who may qualify, please have them call in. And finally, I'd like to thank John Graham again for hosting us today. And then I would like to introduce Kevin Downey from the Michigan Health and Hospital Association to continue the program. Thank you.